Hi everyone, thanks for joining us today. Just waiting a couple of more minutes just to let everybody in. We've got a lot registered today, so it takes a while for them to be able to come online. Hope you all had a lovely long weekend. And it didn't, she's from Queensland.
I was about to say no long weekend here.
No. Okay, well, it's 12:30, so we'll get started on time. And I'd just like to say good afternoon and welcome everybody for attending today's important and topical webinar on sustainable billing and general practice. I'm sure you're all sharing your lunchtime with us, so we really appreciate it and hope you can take away some expert tips to support you, your practice and your staff. My name's Julie Allardyce. I'm a facilitator in the general practice team here at Eastern Melbourne PHN. And I'd like to start by acknowledging the traditional custodians, the Wurundjeri people and other people from the Kulin Nations whose unceded lands I'm working on today. We pay our respects to them and their elders and thank them for their care of the lands and waterways over many thousands of years. We also acknowledge the traditional custodians of country throughout Australia and their cultural, environmental and spiritual connection to land, sea and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So we'd like to give a very warm welcome to our guest speaker, Annette Colburn, who has over 15 years experience in general practice and has been the manager of a large super clinic for over 10 years. Annette is currently the operations manager at Ausdocs Group and also supports the practice managers of 11 general practices. Annette was awarded 2020 Queensland Practice Manager of the Year and is in her second year as an AAPM State Committee member. And it is also a accreditation surveyor who enjoys supporting, educating and ensuring compliance with accreditation standards. So we're looking forward to Annette sharing her vast general practice knowledge with us. Just before we begin, just to let you know, everyone is on mute. You can see the Q&A button at the bottom of your screen. So we would ask any questions, please pop in the Q&A box and we will facilitate these at the end of the session with Annette. Today's webinar is being recorded and all attendees will receive an email with a link to a copy of the recording and any relevant resources, and certificates of attendance will also be supplied to those who have joined us online today, but please allow maybe a week to receive this certificate. At the end of today's webinar, there will also be a survey. We'd be very grateful if you could fill it in because it greatly helps us provide continuing education and what topics that you would like to see. And also, can I give a little plug our PM Day that's coming up on the 29th of March in Doncaster. We're really excited to present this. It's a face-to-face event. We have some great speakers and some great topics and would love the opportunity for you all to come and have a chat with all your peers. The registration for this is on our events page on our website. It's also being posted on Basecamp, or if you need any extra help, you can contact us at Practice Support and we can register for you. So now I'd like to hand over to Annette to begin our session today. Thanks, Annette.
Thank you so much, Julie. I appreciate the opportunity to speak to you all today and for you all joining as well. I'm very passionate about healthcare and in particular, I'm very passionate about helping managers. I think by sharing knowledge and helping managers be the best managers that they can be, we are just ensuring that we continue providing good healthcare and looking after our teams within Australian healthcare. So I'll pop along through here. So just down here. So, well, first of all, I will just welcome you all. You've all joined today because something has sparked your interest in transitioning to mixed billing from private billing. Perhaps you're looking at doing it in the future. Perhaps you've already started. Or maybe you're just seeking some more information because you're already doing it and a little bit of validation as to why you've made the change. You've probably already started to research. You've watched some webinars. You've read documents. You've read news articles. And you've already gathered an abundance of information, or perhaps this is your first exploration today of looking into changing your billing over. I'm here to discuss things that I've noted in my roles in general practice, where I have been involved directly myself. I'll just let you know quickly of my experiences in regards to changing from bulk billing to mixed billing. They started off as being a senior receptionist in a bulk billing practice. The owner did try and implement adding a small gap fee onto our charges for our patients to sustain our practice. Unfortunately, the practice manager and the lead doctor were not advocates for private billing, and they were not quite supportive. And because of that reason, I witnessed and was able to see how it couldn't work, and the obstacles that were put there for it not to work. And what resulted in that is that within 12 months, that practice closed doors. It wasn't able to sustain the upkeep, the costings, and ultimately the practice closed. My next experience was as a brand new practice manager of a very large practice with 18 doctors and 6 allied health. Being new to practice management in that role, I had to change it from a bulk billing practice to a fully private billing practice. Obviously, there was things that popped up during that time that I noted that could have been done better, that should have been considered a little bit more, how it rolled out. There could have been changes that happened. So I was able to actually see in person and go through that whole transition in a very large practice in my hometown as well. And then also now as an operations manager, I assist trying to educate practice managers and lead doctors as to why the move to private billing and mixed billing is so important these days, and try and get them to see that and assist with them in identifying which way that they can go in their billing that is best for their practice, their team, their patients, and their community, their locations as well. There's so many different factors that come into it. But I think by educating them on how to properly manage and lead that change, it would avoid the things that I had experienced prior to that. And that was firstly, as a staff member, seeing the attempt of that transition fail, which resulted in a practice closing its doors, which is not what we want ever to have to happen. And also dealing with the obstacles that came up through managing the change and leading that change in a very large clinic myself. So I'll go through some things today, some things you may have already heard, some things you may not have, some things you may know that are a little bit different, because realistically we all learn through different ways and different means and different styles. But all I can say is that the most information that you can get a hold of to make this change for your practice is really going to benefit you. So watch, read, educate yourself as much as what you can. So just starting off in regards to sustainability of your practice, being aware of and continuously evaluating the performance of your practice to create a sustainable future. And that's why I'm a big advocate for, business planning and looking at data reports and seeing where your practice is at and where you can improve it. There's so many different software options these days where you can extract data and look at billing opportunities and all that sort of stuff. And it's really important as a practice manager to really look at the business side of your practice, although it's, of course, the main goal is providing healthcare, okay? And then we've got to look after our team. We have to manage so many different components. But it's really important to remember that we actually have a business, and this is a business that we are managing, and we really need to be aware of the performance and how it's going. Identifying and understanding the limitations and demands that can impact the growth of your practice. And again, that's where you sit down and you really need to look at what your strengths are. It's a whole SWOT analysis. So you've got your strengths, your weaknesses, your opportunities, and your threats. And when you're looking at a transition from changing from bulk billing to mixed billing, that comes into all of them. You've got the threats of patients leaving, okay? But you've got the opportunities of new patients coming in now that you're not booked out for 2 weeks, with patients that come every week as maybe a social outing, or, aren't coming and dealing with matters on a day and they just, I'll just go back and see the doctor again. I'll just go back and see the doctor again. It creates an opening for and opportunities for new patients to come. You've got your strengths, increasing the revenue, which is a massive thing. And you've got your weaknesses, is perhaps the culture in the practice. That could be a weakness where, people aren't open to changing to private billing. So it's really important to analyze all of those components and see where you are at now, and then use that to see where you can grow, and taking that into consideration for all of your action plans, all of what your your goals are that you're going to set, and take all of that into account. How is your business sustaining and being a viable business? And can it continue to provide high quality care to your patients as it is running now? If your practice is running at a loss, how will you provide high quality care to your patients in the future? Are you still going to be able to, have as much staff on? These wages aren't going any lower, are they? Are you still going to be able to have that same quality medical supplies? There's so much that needs to be looked at to make sure that your practice stays alive. So we'll move along to the next one here. There's many risks to practice at the moment, and you will see that there's a lot of news articles going around. There's a lot of talk about practices moving from bulk billing to private billing, and it is the new reality. We can't be reliant on the government, okay? And what we need to remember is that general practices are small private businesses, and they're closing down. And we need to ensure that that doesn't happen, because then we're risking the healthcare of our community. GPs only receive the patient's allocated rebate for their healthcare at the government's determination of what that is worth. Okay, so GPs aren't employed by the government. They're simply just being allocated the rebate from the patient at what the government states that they have to get. And that's really important to remember that part of it. The incentives for doctors to join general practice as a specialty is dropping. They're sitting there and they're looking at, the work-life balance, which is pretty non-existent for GPs these days. They're risking burnout. They've got high patient turnovers. There's so many different things where general practice is, quite honestly, just becoming less attractive. And I don't know about down in Melbourne, but I know where I'm based, you can see that in the reduction of registrar doctors. It's a massive thing where you will have in your whole region 2 registrar doctors to get stretched out to 14 practices, because it's less attractive now to come to general practice. And that's a real risk. And that's where we can change that through what we do in our own practices. The other risk is cutting costs. So in order to sustain the business, your costs are a little bit high, so you're going to have to cut them down, which means that rather than offering an above award rate to staff that are coming on, we might just have to stick by the award rate. Maybe we won't be able to, buy those high quality medical supplies like we were. And then we risk, retainment of doctors and staff. Doctors want to work. They want to have staff available to be there to help service them as per their service agreement. That's what they're entitled to as a business. We need to have that staff there to retain those doctors. We need to have that high quality medical supplies there to make those working conditions for those doctors to where they can provide that high quality care that they wish to for their patients, be there as well. And in all of that, we risk losing our values as being healthcare providers. And that's something that we never want to do. So, and that is a big risk to our practices with how things are going at the moment, which we'll move along as to why private billing is attractive. Well, it increases the service percentage that the practice gets, which is the practice income, which helps cover our costs, which they're not going down. It can lower the patient intake. If you look at a doctor that sees, say, 35 patients a day, well, they may be able to see 28 patients a day instead. They can focus more on building a relationship with those patients rather than having to push them in and out of the door. You know, when we look at the Medicare rebates in the last 10 years, they've increased $4.15. That's it. They were frozen for 4 of those years. They were $35.60 in 2012 to 2013 and $39.75 now. I'm quite sure that the minimum wage in the last 10 years, medical supplies, electricity, insurances, all those sorts of things, I'm quite sure they've all gone up considerably higher than what $4.15 is, which is what the government has given the patients as an increase, which then comes back to us as the doctors. There has been a rise in chronic disease patients as well, and they need more one-on-one time with doctors. The pandemic even increased a lot of costings for general practice in terms of needing more PPE, having to assign more staff, in particular when the COVID vaccinations come through and we were running COVID clinics trying to have our population vaccinated and create protection for us. But we had to hire more staff to do that. Our costs increased, but nothing else did for us. And the biggest thing is, which I will speak about through this today, is the retainment of your doctors. They need a work-life balance. They really do. They don't want to have to work until, and it's not right that they have to work until 6 p.m. every night and miss their child's soccer training because they need to see those 35 patients a day instead of 28. And I think that's a really important thing to remember here in the whole gist of all of it. Yes, we're a business. Yes, we need to sustain our business, but we also need to look after our people, and that includes our doctors. And the GPs actually deserve this. They deserve to go and watch their child at sports. They deserve to go to a special dinner. They deserve to do those things. And I think that that's a really important part to remember. Just breaking down and looking at bulk billing versus mixed billing, which I'm sure you're already aware of. Mixed billing is where you can set a fee to bridge the gap between what the government said the amount is and the actual cost of delivering quality care. You can choose to either bulk bill or privately bill on a patient-to-patient basis. Pardon. Bulk billing is when you bill Medicare directly for the patient's medical or allied health service. And you accept the Medicare benefit as full payment for this service. And the patient assigns their right to a Medicare benefit to you, so Medicare then pays you directly. There is a lot of options that we can bring forward in terms of changing from bulk billing to private billing. It doesn't have to be just a clean, that's it, we're changing everything over. That's not easy. I've been there and done that one through, and that one was most certainly not easy. Again, it's that whole reflection back, and perhaps in real terms, it should have been myself having a little bit more of a voice a little bit more understanding, educating myself first, looking more thoroughly at the impacts that could have happened on the practice, but also on the team and the patients, and analysing those things first before jumping into changing from a bulk billing to a privately billing practice. I can't emphasise that bit enough. It's just educating yourself and looking at your different options. So, for instance, with bulk billing, you could continue to bulk bill for particular services. You continue to bulk bill for your chronic disease services. You may wish to continue bulk billing for your mental health care plans. Okay. You may wish to continue bulk billing for your childhood immunizations. You may wish to bulk bill for certain patients. So you may feel that, look, I don't feel right in not bulk billing my pensioners over 65. Or, I may wish to continue bulk billing children under 16, or healthcare card holders. You may wish to implement it in strategic ways. You may wish to bulk bill for a set period. So you may have a new patient that comes along and go, okay, your first appointment with your GP today is bulk billed. However, moving forward, any subsequent appointments will be at this costing. You could turn around also and bulk bill for certain times of the day. So you may have a doctor that works, 5 to 6:30. You may sometimes have a little bit of trouble filling up at that time, which I think is probably the most popular time when people finish work. Or the doctor may have some on the hold appointments for the day that he will turn around and say, look, put on hold 5 appointments for the day, open them up in the day, and I will bulk bill those patients. There's a lot of different options there. It's always good to look at all of them. Or you may wish to continue bulk billing all of your current patients and then just privately billing any new patients that come along. That one could get a little bit confusing, but it is an option to look at. There's a lot of different options to look at, so don't just have a closed book on that. Explore, look at what your patient demographics are, your socioeconomic, look at, what demographics come in at certain times and where you can implement some of those changes. There's a lot of options there, and I really encourage you to investigate all of them first. And then it comes down, once you've investigated all of those options, is actually choosing what your practice billing will be. So you need to look at how much does your practice need to earn to cover your practice and personal costs. So you've got to sit down and you have to look at your profit and loss statement. You have to, put your business hat on at this time and investigate what your expenses are compared to what your income is. You need to see what state that business is in to know how much planning you need to do, and really how open your mind has to be at the different options to make sure that those costs are covered. For example, if your practice is really running at a loss, but then you decide just to start bulk billing new patients, it might not be enough. You need to have that understanding on that business side of things to really analyze your different options that you have in terms of the changing to billing that you're going to be implementing into your practice. So I encourage you, even if you need to talk to your practice principal, if you need to speak to your accountants, and investigate, look at that first. You may be able to cut some costs somewhere else in terms of your profit and loss if you have a real good look at that, and you may think, you know what, the team loves that I put on cake every Tuesday and Thursday, and that cake being from the Cheesecake Shop, and I buy 3 and it's about $120, for example, and you know what, I might just change that to 1 day a week and then roll it down to once a fortnight. And I'll cut some costs there, and I'll consider all of those things as well when I'm looking at how I'm going to change my billing schedule. Reviewing options for change, which is what we're just talking about. And that's really which of your patients can actually afford to pay a fee. I've spoken to many doctors that were bulk billing, and that patient would be coming in and seeing them and, you know, organising their travel vaccinations for this big holiday that they're taking, or discussing the stresses of, you know, $1 million house that they've just bought, for example. And the doctors have told me that they felt a little bit deflated after that consultation as they walked out the door, knowing that they're getting, at that stage, $37.20 for that patient coming in to see them. But that patient actually could afford to pay a fee for that service, and they'll probably be really happy to pay a fee for that service as well. You know, as we've discussed, you don't have to make a sudden move. You may just wish to start with your concession card holders first, or your under 16s, and then you can add more on at a time, you know, lessen. So you could continue to, you know, bulk bill your healthcare card holders, your children, your pensioners, childhood immunizations, etc., etc. And then you can have a plan that, you know, look, in 3 months' time, I'm going to review these. I'm going to extract some data. I'm going to have a look, and I'm going to see maybe if we can adjust it again. And it may be that, you know, for example, the children under 16, I'm going to review it in 3 months. I'm going to have a look at that, and we're going to decide that we won't be bulk billing them anymore, but we're going to charge them a discount fee. So they may only be out of pocket $10, $15, but it's going to be enough to bump our practice income a little bit more, the doctor's income up a little bit more, without it causing a massive ripple effect. So that's the other thing to also consider, is remember what you have as you choose to continue as bulk billing. You can always adjust that to a discounted private fee as well. Don't just close the box. It's always got to be open for change. Costs are a reality, and people are well aware of these especially these days. Food has increased, petrol has increased. People aren't shocked to pay for things these days. They really aren't. So, and the other thing to look at is what your opening hours are. For example, if you're open before 7:30 a.m, after 6 p.m, and you're open Saturdays and Sundays where your wages are going to be a little bit higher, perhaps you can actually adjust your private fee a little bit more to help compensate for those wages as well. So, for example, on a Saturday, you may charge, you know, you may set a private fee for $75, but on a weekend, it's going to be $85. And that's going to help compensate for those extra wages that you have to pay for your staff to work on those weekends. One of the biggest things here is discussing with each GP. Ultimately, each GP is their own business. We can sit down and work out what we want to do as a practice, what billing schedules that we want to bring in, but the doctors also are their own business, and that has to be considered and respected as well. The best way to encourage them to follow the path that you wish to set for the change of your practice billing is simply educating them on their worth. You will find that most will be happy to make that move over. Some may be hesitant because they may be fearful that they'll lose patients, or fearful that a patient's going to get cranky at them for having to pay, or anything like that. But you instill that confidence in that GP that they're actually worth charging a private fee. And in that as well, I do think it's imperative when discussing private fees with doctors is that when you're charging a private fee, you must ensure that you are charging a private service. So if you're moving from bulk billing to private billing, and as we spoke about, we threw some numbers in the air earlier, where a GP was seeing 35 patients a day and they managed to pop down to 28 and finish early and go and watch their child play soccer. If your doctors want to continue seeing those 35 patients a day, they must know that you're charging a private fee. You need to ensure that you are providing a private service as well. Before you make the transition, there's really some things that you need to know, and that's where we've been talking about educating and investigating and gaining as much knowledge as what you can. It's really important for Medicare compliance as well, which is one of the biggest issues there. And that's looking at your current services and what your current charges are, and making sure any changes that you make are going to be compliant and they follow the legislation and everything's done correctly. To protect the practice and to protect the GPs. And that's looking at, if you have skin doctors that have multiple excision sites, the services that you provide at the moment where you have an opportunity to even charge a consumable fee. Be aware of the rules that come into play in charging a private fee and a bulk billing fee together. There's many rules that are around that. And it's really important to investigate that yourself once you are aware of what fees that you charge within your practice in particular, and see where you can get around that billing. And I'll use an example. So iron infusions, which is getting more and more common these days. You can't bulk bill the 23 from where the patient's gone and seen the doctor, and and then you want to charge a consumable fee to cover that time the patient has spent in the nurse's treatment area, and that nurse has had to be there with them, overseeing that their infusion is going okay, but you want some fees back for that nurse time. So you can't bulk bill that 23 and privately charge that iron infusion item number. If you can privately bill and bulk bill 2 MBS item numbers, but in terms of services that are done for this in the same consultation for the same service, you can't privately bill and bulk bill. But there's ways that you can get around that, and that is quite simply that you can privately bill the patient the rebate amount. So you're privately billing the patient the $39.75. They swipe their card and the rebate goes straight back into their bank account. They're not out of pocket, but you're covering everything and you're doing it correctly by Medicare. You're being compliant. You're not sending that through to Medicare and getting the patient's rebate paid to the doctor and then charging your X amount of dollars for that iron infusion. You're privately billing them both, but your patient's getting all of their rebate back, so they're not going to be out of pocket for that component of that consultation. So you really need to be open to investigating and having all of that information in regards to being compliant with Medicare billing and how it is to be done, and making sure that your doctors are aware of that as well. Looking again too at your software and your equipment. So that is where, dependent on whether you're using Best Practice, Medical Director, or any other softwares that you may have, setting it up, setting up the standard fees. Through talking to your doctors, you may have a doctor that has turned around and said, look, I'm happy to charge a discounted fee for children under 16, but I wish for there to be a gap of $20, not the $10 that you're saying. You can actually set up that schedule item in your software for each doctor as well. and it just makes it a lot easier for reception. So it's really investigating your software and how you can add those private fees into your software before the rollout. Pardon me, sorry. It's also looking at what equipment that you have in terms of your Tyro, your FPOS. You want to make sure, and it saves a lot of problems, that the patient feels a lot less upset if they can swipe their card and pay, and swipe their card again and get their rebate straight back into their bank account. So investigate all of those options first. I really can tell you that that is an important thing. Yes, we can do it Medicare online and they can get it back in 24 hours, et cetera, et cetera. But a lot of patients don't have a lot of funds. And so that rebate going back into their bank account will actually make a world of difference for the patient, but it actually makes the transition a lot smoother too, because they feel more confident knowing that that money is going back straight into their bank account. It's also looking at managing your appointment book, going through, looking at what existing appointments you have in the future, where that patient may be under the understanding that they'll be getting bulk billed, making a decision on whether you contact that patient to let them know that there will be a fee for that appointment in 8 weeks' time, or you may choose to honour the bulk billing that you had at the time of that appointment being made and make a note in that appointment book that this appointment is to be bulk billed, and to ensure that you let the patient know moving forward that those fees will be privately billed. Again, it's, you know, looking at what services that you will offer bulk billing to or a discount fee to, and making sure that that's clear. A little tip that I used as well when we changed over is that when a patient made an appointment and they were advised of a private fee, a little notation was put in the appointment book. So then that way the doctor was aware when they took the patient in that the patient knew that they would be paying for that. So the doctor had their heads up and they could feel confident knowing that that patient was aware that they would be charged for the service that they're providing. It also allowed reception. You may have multiple receptionists on. It allows them to be also aware that that patient does know. So if they come to the counter and say, well, look, I wasn't told that I have to pay and I'm refusing to pay for this today. Well, there's a note in the appointment book that indeed you were advised. It's all about making it all open and everybody being aware of everything and being on the same page. And that really helps with the transition as well. And then you have to look at how it could affect your patients and the community. Again, if you move entirely over from bulk billing to private billing, you may lose some patients. You probably won't really lose a lot. Realistically, how the healthcare is going, most practices are changing over to private billing anyway. Let's be real. No, we don't want to have an influx of people heading to our emergency departments in the hospitals. No, we don't. But again, analysing your patients that you have, looking at your options and identifying who of your patients can actually pay is a really important thing to look into. And then you can actually be confident and understand a little bit more of why you're doing this. And you'll be more, your patients will be more open to going with the flow of the change as well. And then also looking at what training do you need to provide for your staff. So obviously that training is actually quite broad. It's not just training on, hey, look, guys, we're changing over to mixed billing in 4 weeks' time. So just to let you know, this is what we'll be charging from this date. Doesn't quite work like that. There's a big range of training that you provide to your team, because then that's going to give them confidence. That's going to help you lead this change by giving adequate training. And that is adequate training on, you know, yes, doctors are responsible for what item numbers that they're charging But yes, reception also need to be aware of what's compliant with Medicare and what isn't. Okay, they need to be aware of what groups are going to be getting charged and what groups won't be. You know, they need to be advised of, you know, even if you're going to bulk bill some certain groups for 3 months or 6 months, and then you're going to change over to a discount fee, they still need to know that that could be on the cards in the future. So they can be a little bit more careful with how they talk to patients. They're not going to say, look, no, we're definitely going to continue bulk billing children. That's the decision that we've made. And then in 6 months' time, that same receptionist is telling that same patient, yeah, look, I'm sorry, but we're now going to be charging you a discount fee. Give everybody as much information as you can. They don't need to share it. You need to be clear with them, look, we're going to be bulk billing, but we will be reviewing it. But just so you're aware. But the more information they have, the more they can help the doctors through the transition, and they can actually help the patients through the transition as well. And that's where it comes down to leading and managing your team through the transition. I'm a big one on practice managers. Is 2 components, and that's being a leader and a manager. So I'm very passionate about that. And I believe they can be done together. So you just need to define the 2 and know when it's most appropriate for each one. And that's leading your team. So leading your team is, you need to be confident, you need to educate, you need to be a lot there with them, you need to communicate, you need to get their feedback. You know, what do you think? You know, you need to lead them through this as a whole, as a group, as a team, lead them into the change, encourage them and support them. The managing side of it is that you need to make sure that your T's are crossed, your I's are dotted. You need to learn. You need to learn everything that you can about this. You need to educate everybody before this commences. You need to plan that rollout. You need to plan your action plans. You need to plan what your goals are. You need to plan as much as you can for the best result, and set that target and roll out that plan. And now we're talking about planning the rollout. So we've got our who, what, and how. And, you know, I can let you know that really planning is imperative. It gives you direction. It gives you understanding. It gives you goals. It gives you targets. It keeps you on track is one of the biggest things about planning. So when you plan this rollout, you have everything covered, so you retain focus on what you want to achieve. And you include your team in this planning as well. You take into consideration everybody in this. And the who is, what do your GPs want to do? What's their feedback? What's their perception of changing over to mixed billing? Are they hesitant? Have you discussed the benefits of mixed billing financially? Have you discussed the benefits of mixed billing personally with these GPs? Speak to them each individually, one-on-one. You can have your group discussions and go through everything, but you speak to each GP, which is a GP business, one-on-one, and you make sure they completely understand everything first and include them in this change, because it will affect them as well. And you go through and you let them know what the practice has decided that you would like to charge, what your billing schedule is, what your fee amount will be, what your discount will be, what your plans are in regards to who you want to continue bulk billing. And you give that information to the doctors, and then you get that feedback and you discuss it with them. And you try and get them all on board with you. But they deserve that sit down one-on-one, and they deserved this to be discussed with them, as it affects their business as well. The what are you going to set as your fees? What's going to be your practice default? What your billing schedule, what your fee amount's going to be for each item number, what is going to be your practice default. Remembering that each doctor does have a right to turn around and say, well, look, I'm charging a 23 and I'm doing a full skin check. I don't want to charge $75. I want to charge $90. Okay, that's okay. They can do that. And they're in their rights to do that as well. You need to look at what consumables you want to charge. You know, your iron infusions, have you not been charging them previously because you were just bulk billing at 36 or something like that, which, you know, you should be covering the part for the doctor's time, but you need to recoup some of those costs for the practice as well. So, you know, it's looking at what open possibilities that you have in regards to charging once you're charging a private fee. And again, that's even if you're just charging the rebate amount and the patient getting all of that back, it opens up opportunities to charge other private fees as well. And then what are your fees going to be? Are you going to do a gradual increase? How are you going to work it? And the how? Well, that's your plan. That's just sitting down and that's planning how you're going to do it. And again, with that, you set the date. I'm going to sit down and I'm going to talk to all of my team members here. I'm going to speak with each doctor here. I'm going to analyze our data. I'm going to see, you know, which is the best areas that we can implement these private bills. I'm going to set some timelines. I'm going to set dates as to when I'm going to review this. And you have that plan all set up. So then you're going to be ready to roll that out, confident in what you're going to be doing as well as your team being confident, because you're going to share that plan. You're going to share that plan with them. You're going to let them know, I've created a plan and this is how we're going to do it. And they're all going to use it, we'll all come together and have each other's back and know that this is the best thing for your practice, and understand the plan and be supported and feel confident in this as well. And a lot of that is done through communication, which is a massive thing, and that is your team. So ensuring that they understand and that they're confident with this change, provide adequate training and education. They need to know all of the information. Consistent support. Check in. How's it going? We're 2 weeks in to changing over to mixed billing. Have you been getting any negative feedback from patients? You know, are you feeling that you're having patients are getting hostile or aggressive? You know, where's the troubleshooting areas? Where's the problems? So we can help fix these problems for you. And give them guidance before it even happens on dealing with difficult interactions. That's really important. I think in particular since COVID, I don't know about down Melbourne way, but I know up Queensland way, the world sort of changed a little bit. Patients became a little bit more entitled, a little bit crankier, a little bit more demanding, ruder. I could keep going. And it happened all round, but our biggest parts of our life are spent at work. And these things actually affect us. And when we see it at work a lot, it becomes really obvious of the change that's gone on. And so obviously, you know, we would have been providing our staff with training and education on how to deal with difficult patients through the pandemic, because let's be honest, it brought out the worst in people. When you're going to be implementing a change like this again, where there is a risk factor that your staff could get some backlash from patients, educate them first. Even if you have to source an outside agency to come in, and there's many around, that can come in and give some guidance and give some training before the date, before the notice even to patients, and have them set to be able to deal with this before it happens. It really is the best thing. And that's your doctors as well, because a patient could be nicest part of that receptionist about having to pay, but the minute they're in with the doctor, they can turn around and say, you've bulk billed me for the last 2 years. Why are you going to be charging me now? Everybody needs that training, not just receptionists. A patient could be down fine with the doctor, fine with receptionist, be down with the nurse getting a dressing and decide to have a rant or a vent to the nurse about now having to pay, and now I've got to pay for dressings and yada, yada, yada. Everybody needs that education and training, everybody in the practice. And then the big one is communicating the change to your patients. And that's where, once you've done your plan and you've set a date, you need to set a time frame of adequate notification to the patient. So, I would say at least a month. My personal opinion on that one is at least a month's notice to patients. That's making sure that the word is out there, and everybody is aware, and that will help the transition a little bit easier as well. Again, that's where still in your plan, educating those patients, even as educating your staff, even as you're about to put up those signage and they're going to start getting questioned, try and get that done first, and then plan your rollout in a month's time. I had actually done mine on the 1st of July because I thought it was a great excuse to say that, hey, look, 1st of July, unfortunately, everything's gone up, and a financial year, our costings, we've had to, change our billing structure. That was one of my reasonings that I used, as well as, look, quite frankly, and this is true, the government hasn't increased the rebate, and unfortunately, we can't sustain our practice by continuing to bulk bill. That's real. But again, informing your patients, giving them adequate time. Like I said, I would say a month. New appointments, making sure that they are told. Put signage up around your practice. Make sure that you have it on your website. And you don't even need to just put, we're now going to be privately billing. Actually explain. Have an article on your website. Have a little blog post and just say, look, this is the reality. This is where practices are standing at the moment with continuing to bulk bill and how it's not sustainable. This is different, and this is what we've had to implement, and this is why. You don't have to overshare, but you can give enough information to educate those patients as to why you've had to make the change. Your online appointment software, so AutoMed, HotDoc, all those sorts of ones, you could use that to extract some CSV files and send through broadcasts to the patients, letting them know that there's been a change in billing. Obviously, by using those data extraction tools, you can remove, your children under 16, your concession card holders and your pensioners. So then all the other patients are just getting the broadcast in regards to the change of the billing. A phone message. Straight away, your on-hold message. Please note, as of the 1st of July 2023, we will be adjusting our billing schedule to include private billing. If you'd like further information on how this affects you, please ask our reception team. Something just as simple as that. And you can also send out letters and emails. There's lots of different options there that you can do to inform your patient. Just make sure that you provide adequate time. That is the most essential thing. Again, and I can't say it any more, is that be confident in the change that you're wishing to implement. GPs are highly trained professionals, and in order to sustain that quality care, they should be paid appropriately. They really should. And the practice needs to be paid appropriately too through their service fee to be able to keep our practice open, to continue hiring our staff, to have those great medical supplies, to keep our doors open. Let's not lose any more practices. Healthcare is too important for general practice to suffer the way that they have and have to close. And if it means that we have to start charging some of our patients, then that's what we have to do. Because we want to continue, again, to deliver quality care to our patients. It's so important. And then just finally, one last word, because I am a woman and we like to get our last word, is that the past few years have been particularly challenging for general practice and our teams. We're all aware of that. It's been really rough few years, and we've lost doctors, we've lost good staff to the stress that has come through being a part of a pandemic. But it is a time, and I'll just give a gentle reminder, to always be kind to others and to never forget to be kind to yourself. One of the most important parts, in particular, of being a practice manager, which I believe most of you are, is you must take care of yourself. Self-care is imperative. Know what your stress indicators are. Identify what you can do to assist yourself in times of feeling stressed, and being able to effectively communicate that, and also being aware of your team members and identifying stress indicators in them and how you can assist them as well. It's a really important time to continue. Well, it's not just a time now, it's just if anything from the last few years, bring us all back in, let us care for each other, let us look after each other, and let us continue to be able to provide healthcare for our community, because we wouldn't be working in healthcare if we weren't passionate and have empathy towards other people. So anyway, that's my spiel. I hope that I've been able to assist you today, just with a little bit of insights into moving over to mixed billing. So thank you, Julie. And thank you, everybody.
Yeah, thank you. And there was some great information there. Whatever journey practices are wrong, whether they've been mixed billing, bulk billing, checking in on your financials, your profit and loss, and communicating with your staff. It's all really, really good, relevant information. I've answered a few questions in the chat, and there doesn't seem to be any in there for now. But if anybody does have any questions, if they contact practice support, I can certainly pass them on to Annette for you. So again, I'd just really like to thank you for your presentation today.
No worries. Look, I really thank you all, and I thank everybody that joined today. And just know that you're always doing the best, and just make sure that you take care of yourself. It's my biggest thing.
Yes, good advice. Thanks, Anna. And if everybody could kindly just remember to fill in our survey, that would be much appreciated. Have a good rest of the day, everyone. Thank you.
Thank you.